to suction you. They like, all right, cool. I go to suction the patient. Hey, I'm trying to help you though. What we represent, man?
Big money bound.
Say, let her know, man.
Big money bound.
The kid, man. You got the kid, man. I'm headed home, man, and I'm headed to my full-time job today. Go home, get some rest, and I'm back over there, man. I gotta get this cheese, man. I gotta get it, though. Man, it's raining. All right, I'm gone. That's real. Big Money Bound TV, RRT POSSE, YouTube. If you're new to the channel, please like, subscribe, and turn on post notifications. I release scheduled videos every Monday, 12 o'clock a.m. Eastern Time. But I also release unscheduled videos throughout the week. Now, if you're returning, hey, welcome back. I appreciate all of the support, man. Thank you. I just left my per diem job. And now it's raining outside, man. My head all wet and all that. But, hey, I just left my per diem job. Now, y'all know when I normally go there, I get pediatrics. And I prefer not to work pediatrics. I don't want to say I don't like pediatrics. I just prefer not to work it, you feel me? But they had me in, I was in a step-down unit. I had 2 patients on a vent and 2 nocturnal BiPAPs. And I had a few treatments. And I was also covering the trauma area. But hey, man, luckily, ain't no trauma alerts come in, man. Thank you, cause like I can do it. I can do trauma. Trauma is all the same, you know. Once you really understand that, like, you doing your job and your job is the same. Respiratory therapist. I'm at the head of the bed. I'm assisting with intubation. I'm putting the patient on a vent. I'm drawing the ABGs. I'm getting the blood. No matter how it goes, somebody rapid response, cold, blue, trauma, surgery, no matter what, my job remains the same. I'm the airway. I'm oxygenation. Like, I know my job. But I just don't like, bro. Sometimes you be saying like limbs and shoulder blades open, legs cut off, noses scarred up. I wasn't really trying to see that last night, man. I'm talking about you seeing burns. You see crazy stuff, man. Gunshot wounds, knives still stuck in somebody's head. Like, bro, you think I want to look at that right now? So I was hoping I ain't get none of that. And I ain't get no trauma alerts, man. But y'all done seen some wild and crazy stuff in that, man. For real. I told y'all the one time I seen them do a bedside tracheotomy. Right there on the spot. Like, just no emergent. No operating room, just go in there. Oh, man. Come on now. So, that didn't ring. I had the ventilated patients, and I had a few trachs. A few patients that was on cool aerosol trach T-piece. So, with the T-piece, they was on a fenestrated trach. If any of you guys know what a fenestrated trach is, that's a trach. It's a trach, intercannula trach. I'm going to put a picture of that. It's a trach, and it has a hole in it. That's called fenestrated. Not the bottom hole, but within within the tubing, there's a hole on it. So sometimes when you put the suction catheter down there, it gets stuck. And it's very hard to intubate. It's very hard to suction if you're not used to it. The nurse is like, yeah, I'm having a hard time suctioning. It's like once you go in there and you feel it get stuck, you got to pull back a little bit and twist. And twist the piece, the catheter piece, and it'll shimmy on down there, man. But that comes with experience. That's what I'm saying. Like, a lot of stuff you learn at school ain't gonna be everything you need to make it in the real world. Like, I didn't know that in school. Like, when I was in school, nobody told me that. But I learned that in the field as I went along, and things started getting stuck and it wasn't working. I had to figure something out. I ain't come across that in that book. You feel me? So when you graduate, man, you gonna know like 5% of what you need, of what you're gonna learn in the field. You gonna know 5%. The field gonna teach you the rest of the other 95%. You feel me? So that's what that. But overall, like, I had a good night, man. And it's like, it's good to have, I keep saying that it's good to have 2 jobs, because you learn how to do things like 2 different ways. Like, when in Rome, you do as the Romans. Things I do at my per diem job, I wouldn't do at my per diem job. I wouldn't do it. I'm tired. Things I do at my per diem job, I wouldn't do at my full-time job. And vice versa. If I did something that they do at my per-diem job, at my full-time job, people look at me like I was crazy. And vice versa, man. People look at me like I was crazy. So I'm in there like, does this thing have a filter right here on the BiPAP up here? I'm like, this ain't how I normally do it, but this how we do it over here. I can adapt. You feel? I ain't finna come and change our whole policy saying this is right, this is wrong. The patient being taken care of, the patient good. Hey, when in Rome, you gotta do as the Romans. So that's how it is with that. Man, it's like, it's a lot of things I've seen with that. I was like, you gotta adapt, you feel me? That's, what else that's with, man? Yeah, that's for that. Oh, yeah. With the PPE equipment, man. At my full-time job, they say, man, here go your one mask. Like, just around the hospital mask. Not N95 mask. Just the one you got to wear through the hallways of the hospital. Once you clock in, you coming in to work, you're going to your department. Now, once you're in the units, you're going to have a new N95 mask. So, just to, like, the normal face shield mask, they give you one of those and say, okay, you got to hold that until this here gets soiled or it break. That could be whenever. Just hit my funny bone, man. Oh, man, that hurt me, dog. Oh, man, I just hit my funny bone, dog. So that could be whenever, man. So you got to hold on to that one mask until it's soiled or it break. Now, over here at my my per-diem job, they giving those masks away like it's nothing. I asked her, can I get one mid-shift? Oh, yeah, sure, no problem. It's an abundance. You get one. At my full-time job, you got to sign your first and last name and all this for a mask? It's different everywhere. It's different. Now, for the gowns, at the per-diem job, they watching those. But at the full-time job, they throwing gowns away. They throwing gowns after here, take the gowns. So, you got to just, like, you got to know how to coexist in every surrounding, you feel me? Every situation, you got to know how to, like, prevail, you feel me? So, and that's the beauty of, like, working two jobs, man. But, I'm really finna get back on this paper chase, man. I understand it's COVID out there. I'm with all that, man. I gotta get these riches, dog. I don't got one too many, like, normal checks. Like, it's cool, whatever it is, you know. But me, I'm like, I'm so big money bound and ambitious. Like, if I can get more, I gotta go get more. If I can get more, if I can get more, I gotta get more, man. But I'm gonna go out there and I'm finna get that. I'm finna get more, man. I'm finna go get more. Finna really go get more. I don't got, like, I don't know. It's hard to say that I got motivated. Like, I've been motivated. I got more motivated. You feel me? Like, I'm finna really stack this cheese up, man. Like, for real. But I'm already stacked it up. But yeah, man. But besides that, it was a good night. Oh, man. Man, these nurses, man. Like, at my full-time job, we don't do EKGs. The per-diem job, the respiratory therapists do the EKGs. Man, this nurse keep putting in stat EKGs left and right, bro. Oh, the patient, I don't like how the patient's heart rate is going up, bro. The patient breathing, dog. The patient just got done rolling around, breathing heavy. Now their heart rate elevated. Ain't nothing wrong with that. Oh, I got a stat EKG. I'm like, wow, what's going on? Oh, their heart rate is elevated. All right, cool. Okay, let me go and I'll do it. Normal rhythm. Normal. I guess they must have just been moving around a little bit. Like I'm saying they was doing. All right, now, she called me again. An hour later. I got another stat EKG. Hey, man, hey. All right, I'll take care of it. I go in and look at the patient, man. Dog and eating donuts, man. Dipping his donuts in chocolate milk. Dipping his glazed donut in chocolate milk, man, eating it. Like, bro, this dude, bro, come on. Like, stop, man. But once that order put in, you got to do it. So I took care of it now. But I still had work to do, if that makes sense. I had work to do, but I did take care of it. But I also had work to do, you feel me? Yeah, dog, I had to do my own work. I'm in there suctioning patients that got trachs, man. I'm suctioning the patients, but the patient getting mad with me. I'm like, all right, I listen to the patient breath sounds. Patient coarse, gurgling, like it's fluid in there, the vent alarming. I gotta suction you. They like, all right, cool. I go to suction the patient. Hey, I'm trying to help you though. It's mucus flying out. It's mucus coming out of here like left and right. I'm trying to clear your lungs. That's all. I'm not trying to purposefully make something uncomfortable for you, but I gotta get that mucus out your lungs, baby. I'm respiratory therapy. This is what I'm telling the patient. I'm like, hey, like, I understand it's uncomfortable, but it's a lot of mucus coming out here, and I'm just trying to help you. I don't want you to get pneumonia, you feel me? We gotta keep your lungs clear and get you off the vent. I'm here to help you, baby. She's like, you know what, you right. She tapping me like, yeah, you right. Nah, what they tapping me? I was wearing a gown. Cause hey, I'm saying it's COVID. I ain't saying she got something on the hands or hey, but I don't know. And it's COVID out there, so I'm going every room I'm strapped up, dog. If I'm going in, I'm strapped up. If I went in, I was strapped up. If I ever went in, I was strapped up, man. Hey, y'all have a good one, dog. Like, hey, man, thanks for all the support, man. Keep rocking. I'm gonna keep dropping the videos. And somebody hit me up about doing a mechanical ventilation review, about doing a vent review on the vent, mechanical vent, do a review on the vent. Like one day I'm gonna do that, but right now I can't because I don't have access to a vent outside of my workplace, and I'm not gonna be at work recording stuff. Hey, nah, not at work. That's a HIPAA violation. This how I eat, and this big money bound, so I can't jeopardize that. But one day it's gonna come a time where I'm gonna get to like a vent outside of the workplace, and I'm gonna like do a full review. I'm gonna give you like all the tricks, all the shortcuts, how you can watch stuff, patterns. I'm gonna give you everything I know. I'm gonna tell you, man. So until then, just keep rocking. Just keep rocking. I'm finna cut it off, but keep rocking. I'm finna cut it off now, but just keep rocking.